All right, welcome back to the big show. Thanks again for tuning in so far. Make sure you give us a like, a love. Make sure you share the conversation with your friends, your family, your colleagues. Our charities are so important to all that we do in our community. So welcome back to the big show. She's Mia Chambray. I'm Jamel Hartman. It's the Daily Hour brought to you by the BAC Group of Companies, Medical Lindos, and People's Pharmacy. As you saw, go fill out the survey if you have not done already. And don't forget to subscribe on our website. Follow us on all of our social media channels to stay up to date with all that we have going on. Help us grow beyond the mic as we do our part to continue to improve our community. Without further ado, let's give a warm TDH welcome to our guest today. We're talking about, I mean, it's fitting. We don't plan our discussions this way, but we're talking about breast cancer awareness and some of the things that they need help with to ensure that people and persons who are in need have the opportunity to have the best quality as it relates to their health and breast cancer in particular. So give a warm TDH welcome to Debbie Titterton Narraway. Here we go. Welcome to the show. How are you?
Good morning, and good morning to the Daily Hour audience.
Thank you. Well, first off, Mia and Maya, they talk a lot to the world. Yeah, you should have heard them. I was just sitting there like, we got Debbie. You know how good. No, I'm
not sure they were doing all the talking, but it was a good conversation.
No, absolutely, and thank you to Mia for coming up with such a topic. Because I mean, I don't know if you had anything to add to that before we jump into today's conversation, but did you have any? Because you work in this space. I'm speaking from what I see as a person who's donated to many charities. But did you want to add anything, like based on your experience working within your organization?
I think Bermuda's come a long way in the last couple of years with charities. As Maya mentioned, or maybe it was Mia, that it's not an easy process to become a charity today. There's a registration process. You have to meet best business practice. You have to renew every year. So people who go into the charity world are not taking it lightly. Some people are in it because they found a gap or a need in the community. Others, it's a passion project. A lot of those pages that you were looking at were PTAs, sports groups. So they are fundraising for sort of a different need. But I think it is a sector, like any sector, that needs to be watched and supported.
Yeah, thank you for that. Thank you, Debbie. Well, let's jump into Bermuda Cancer and Health. Tell the audience, those who may not know, a bit about yourself and what it is you do with Bermuda Cancer and Health Center.
So, as Jamel said, my name is Debbie Titterton Narraway. I am the Chief Marketing and Fundraising Officer at Bermuda Cancer and Health Center. Those who know me know I've been here for quite a long time. I did a stint here and then left for 2 years and then came back. For me, it is a passion. I enjoy what I do. I enjoy the people in this realm. So it just keeps us ticking along.
Indeed.
It sounds amazing, Debbie, and thank you for being on the show today. I think not only, as Jamel said before, it's not just about women, it's also about men as well. And what are the main causes of breast cancer?
So like most cancers, they are, a lot of people would think hereditary. We hear a lot of hereditary conversation in Bermuda. But I think that is amplified because we are such a small community. So we know a lot of people who may have been diagnosed with, or aunts who have, or family members or colleagues. Most of our cancer rates are on par with the rest of the world. Most cancers are through things that we can actually help to reduce our risk factors in. So it's leading a healthy lifestyle in terms of a healthy diet, not being obese. Obesity has a lot to do with breast cancer. Exercising regularly, and that does not mean, running 5 days a week or being in the gym 5 days a week. It's moderate exercise, walking, strength training. Quit smoking if you are still smoking. Smoking is the leading factor in many cancers, not just lung cancer. In Bermuda, we say reduce alcohol because we think we would lose all our support, but it should be no alcohol. Alcohol does cause cancer.
Oh, yeah.
Getting screened. So there are screening recommendations for a number of cancers, breast cancer being one of them. And the other one is going for your annual checkup. Talking to your doctor about your risk factors. If you're overweight, is that playing a part? If you have a family member who's had a cancer, talk about that. They look at the type of cancer, the relationship to you, and they determine when your screening should start.
That's really informative, Debbie. Thank you so much. I have cancer in my family, so I'm super hyper aware of it. So not breast, but cancer is still cancer at the end of the day. So I'm actually going to have to start to get colonoscopies much earlier than anticipated. But when I'm in the shower, like, you know, cleaning and doing my thing, I'm kind of doing a self breast check, but kind of what's the best way to do that? I'm just kind of freestyling at this point. But, you know, what should you be feeling for? And this is for, you know, Jamel too. This is for men and women.
Absolutely.
But like at this point, I'm kind of like just freestyle. Like I said, I'm just doing my best and kind of, you know, and I also heard that you should ask your partner to assist in helping for irregularities as well. You know,
oh, that makes it more fun.
If you have one, you know, because they might detect something that you kind of don't really perceive.
So I think the key about breast cancer is most of us think a lump, but you are looking for much more than just a lump. So a self-breast exam every month is a good habit to get into. You are feeling for any change in your breast tissue. If you do feel a lump, our breasts are naturally lumpy. You'll feel things that are like soft and round like a pea. Those are your milk loaves. Hard seeds could be a cancerous lump. Soft beans like a kidney bean could be your lymph nodes. So just because you think you feel something doesn't automatically mean cancer. It's something you should watch and again talk to your doctor about. But there are 12 signs and symptoms of breast cancer. If you're looking for any change, thickening of tissue, growing veins, sunken nipples, and the center does provide a wonderful free educational program, Know Your Lemons, that will help men and women understand changes in their breasts, what that looks like, the best methods for doing self-breast exams. So it's a great presentation to book with your friends.
Oh, I love that idea. I do a lot of girls' nights, so we could say, hey guys, we're going to learn how to check our breasts.
Yeah, and we have a lemonista, Ajurie Williams, who will come out and she will walk you through what that looks like, how the amount of pressure you should be using. Again, the full 12 signs and symptoms of knowing, we call them your lemons. We actually partner with the Know Your Lemons Foundation from the US, and the reason we went that route is they have fabulous graphics that really just take the sexualization out of breasts using lemons and in simple, bright colored graphics show women what to look for.
That's amazing. Now, we're definitely signing up. I'm going to put it in my girls chat after this, but I want to become a lemonista for sure. But Debbie, you know, I recently, as Jamel pointed out earlier, I'm older than the internet. So that's that being said, so for my 40th birthday, I treated myself to a mammogram, you know, which was so much fun. But I know that you are trying to fundraise to bring in a new mammogram machine. Now, I have to be honest, my mammogram was not comfortable. Jamel, you've never had one, so they are not comfortable. They squish you and pinch you, and you got to stay in this position, and then they do the thing, and it's not great. But at the end of the day, of course, you know, it's better than the alternative, which is cancer. But what about this new machine is going to be different than kind of the current process of how we get mammograms?
So we currently have 2 mammography machines. We actually installed one in the middle of COVID in 2020. That was a feed into itself. And the one we're looking to replace now, we installed in 2008. So like every piece of equipment, there is a lifespan for the equipment. We never want to get into the position where the equipment is not working optimally, or it decides not to turn on one day.
Right.
We would never want to have to push out appointments for a year and make people, wait and worry. So the machine we put in 2020 was a bit of an upgrade in the fact that it was the first machine to be designed for women, still being designed by men. But it has softer edges instead of pointed corners that you're resting your tissue on. Actual handles, when the lady says, put your hand here, instead of just grasping the side of a machine, there are actually handles to hold on to. And with each new, every year that passes and improvements in technology, we're seeing less on the machine, but more about what the machine can do. So the one that we are looking to install, hopefully next year, will have a higher sensitivity, meaning more accurate diagnosis. It's quicker and more efficient. We should be able to cut 7 minutes off a mammogram appointment.
Wow.
And high specificity, which means lower false positives. So most of us dread having the mammogram and waiting and getting the call back to say you need more imaging. More imaging doesn't necessarily mean cancer. There could be a lot of reasons, but it's that waiting moment and having to come back. So the less false positives, the better.
Indeed.
Indeed. Yeah. And just for the viewers at home, you have different densities of breast tissue, and I happen to have very dense breast tissue, which means that my lemons are still very young. So I'm very happy about that. Now, if a patient doesn't want to get a mammogram, what other forms of detection are available, Debbie? Tell us.
So mammogram is still the gold standard. It will detect the most cancers in their earliest stages. But we also use ultrasound, and the other one would be an MRI. The MRI isn't using radiation, but it does have a much higher level of false positive reading. It's not designed to be doing that specific service, but there are options out there. The biggest one is your self-breast exam. Obviously, if it's a lump, that is an easier sign and symptom to be brought in, because that could be ultrasound, that specific area. And then biopsies are actually the only way that you can tell someone they have breast cancer.
Okay.
Indeed. Audience, if you have any questions or comments for Debbie, please send them through. We've got Manuela Jones. She's asking, should persons who have already dealt with their breast cancer or any cancer still be on the lookout for signs of cancer?
Absolutely. Unfortunately, breast cancer does not discriminate. Doesn't matter the age, whether you've had it before, the color of the skin. I think the conversation is really between you and your physician, your medical team, on how often you should then be coming back in to be re-examined. It does become much more of a medical process at that point and how you think about it. But certainly you should never say, oh, I've had cancer, it won't be me again.
Indeed. Suzanne Ingham, she says she declined her mammogram this year. I just wasn't up to being squished this year. Sorry, TB and cancer. Speak to us, because I'm sure that's probably the norm. What would you say to people like that who just don't want to go through it?
Absolutely. So there are screening recommendations, and they are just that. They are recommendations. So current screening recommendations are women age 40 to 44 should start talking about and having mammograms. And again, it does depend on your risk factors and your family history. By 45, women should be having an annual mammogram. 55 and older could move to every 2 years, depending on your risk factors. And then screening should continue as long as you are in good health, and they say expected to live 10 more years. I don't think most of us can pinpoint that, but that's the recommendation. So there are a lot of variables in that, and it is between you and your doctor. Mammograms, they are not comfortable. They can definitely hurt. Everybody's sensitivity level is different. There is the thought that it costs a lot, and we can talk about that in a minute. I'm just not up to it. And again, if your risk factors are not saying you are sort of on that path to maybe being diagnosed one day, missing an appointment is not an issue. As long as you come back, I mean, what you're looking at is each mammogram is your baseline. So when you have your next one, they look for any changes.
Indeed.
The more often you have that, the earlier you're going to detect the cancer.
Got you. And I wanted to, like, you know, one of the questions that comes up on this show pretty often is cost and insurance. You know, there are some people, as Mia mentioned, you know, they may be hereditary in their family. They may be more at high risk. Is it something that's out of pocket? Is this why organizations like yourself raise money to support those? I mean, we've got a population who can't feed themselves and house themselves right now, and they need this care. How does it work with Bermuda Cancer and Health Center?
So unfortunately, Bermuda also has an aging population, and as people age, health declines, and you're more likely to be diagnosed with something. And cancer is one of those. So they say 1 in 2 people will be diagnosed with a cancer. It's 1 in 8 for women and breast cancer. So in your lifetime, 1 in 8 women will be diagnosed with breast cancer. If you look at your friends, family, colleagues, I'm sure there's 8 of you sitting around. At the moment, mammograms, screening mammograms, are covered under the standard health benefit. So they are available to everybody. At Bermuda Cancer and Health Center, we do not charge a copay. We do not want the finance of any of our services to be the reason you don't walk in the door to have something done. As we talked about, there are other barriers, the comfort level, the fear. We don't want money to be that. And that goes for all of our services, even the ones that are not covered by standard health benefit. So if you have health insurance and it doesn't cover 100% of your mammogram or your biopsy or your radiation therapy costs, we have a fund, we call it the Equal Access Fund, that the community donates to and helps cover the balance of that. If somebody has no insurance, they are still not asked to pay anything, and we dip into that fund as well. Again, so we really don't want, you know, can I afford it to be the reason you don't walk in the door to have an appointment.
And you literally just answered Charles' question about what about the uninsured at the end. But he said something. Charles H. F. II says, not to scare anyone, but my mom skipped her mammogram in 2018, and in 2019 she discovered she had breast cancer. And thank you for sharing that, Charles. Not to scare anyone, but I definitely appreciate that. But we have a question from Manuela John. She said, I was advised years ago that a person should commence regular mammograms 10 years before the age of the youngest family member who had breast cancer. Is that still the advice?
So I am one of those. My mom was diagnosed with breast cancer at 37. So at 27, I was recommended to start with annual mammograms. And I started at 29, and I've had an annual mammogram ever since then. So if there was a hereditary or young person type cancer, it could have been caught. Today's philosophy is a little different. They do look at the radiation impact on the body and the breast tissue. So they don't necessarily say it has to be every year. But again, it depends on your personal risk factors, the extent of your family history. Is it a genetic family history? And you should be talking to your doctor about what that looks like for you. So the guideline now is still to have your baseline test done 10 years prior. But then it could be whatever increments you and your doctor decide on based on your history.
All righty. Final question. I know we don't want to keep you all morning, but good conversations do that. But let's speak about the community, the community's role. How can the community help Bermuda Cancer and Health Center in its efforts to ensure that you have the best equipment and the ability to continue to educate the population about not just breast cancer, but cancer in general?
That's a loaded question. We are so fortunate to have amazing community support through, we have the Breast Cancer Walk, we have a Man on the Run, we have Movember and Relay for Life as our big community fundraisers that are very heavily supported. Most of that fundraising generally goes towards our Equal Access Fund. It costs the center about $2.2 million a year to cover the cost of uninsured and underinsured patients. So where insurance doesn't cover the full cost of an appointment, and those without health insurance, so that we don't have to ask them to pay when they come in, we have that fund. We are currently only raising about $1.6 million of that $2.2 million needed. And that is specific. So when somebody donates equal access, that's the only place that money is spent. So when it comes to replacing a piece of equipment, this is why we put out this Mobilize for Mammograms campaign. We even need to raise $400,000 to be able to replace this piece of equipment. We also have other needs. We have an education program that goes out, and all of our education programs are free. So a lot of people know us through our SunSmart program, where we are in all schools and have a summer camp accreditation program, teaching young people how to protect themselves from the sun so that when they are adults, they are not diagnosed with skin cancer, because unfortunately the damage is done while we're young. We have a men's health program. We have the Know Your Lemons, where, as I said, Ajurie, our Lemonista, comes out. She'll meet with groups of 10 more and talk about self-breast exams, understanding your risk factors, the pathway for breast health and breast cancer should you be diagnosed. So these are, timely, heavy people, resource heavy, and we need funding for those as well. So our education program is currently not funded. So we sort of limp along year to year trying to keep those pieces going. So there's a lot of need for funding and community support. But as I said, we are very grateful that most of our fundraising actually comes from the community. The other way community can help is by volunteering. So we need help at our events. We also have needs throughout the year in the center, and you can look on our website and register as a volunteer there as well.
All righty. Thank you so much. This conversation was helpful. As Charles H. II says here, I wasn't aware of that fund. That's awesome. I wish we only needed charities such as this, but until we need the other charities as well. So Susan Henningham says a very worthwhile charity. Debbie, thank you so much. Keep in touch. Let us know if there's anything we can continue to do throughout the year as you guys keep striving to make sure Bermudians have what the preventative measures needed to address cancer in our community. So thank you.
Yes,
thank you. And you can go to www.chc.bm.
All right.
Thank you, Mia and Jamel.
Good day.
Bye, Debbie. Thank you. Nice to see you.
All right. Debbie Titterton Narraway, folks, Bermuda Cancer and Health. If you appreciate that conversation, please give us a thumbs up, a love, a like. Make sure you share that conversation with your friends, your family, your colleagues. We have a question coming up for the Daily Play. I think Debbie should know the answer to this. I'll just
gosh.
Here. Mia, email
yes?
answer too. Don't panic. We'll be back in 57 seconds. Stick with us, audience.